Bulimic complications. Bulimia is a serious, potentially life-threatening eating disorder. People with bulimia may secretly binge eating large amounts of food with a loss of control over the eating and then purge, trying to get rid of the extra calories in an unhealthy way. To get rid of calories and prevent weight gain, people with bulimia may use different methods. For example, you may regularly self-induce vomiting or misuse laxatives, weight loss, supplements, diuretics, or enemas after binging.
Bulimia, or bulimia nervosa, is an intense cycle of binging and purging behaviors. It's an eating disorder which includes taking in high-calorie foods and then purging, perhaps by vomiting or using laxatives to get rid of the food. Binging is the act of eating an enormous amount of high-carbohydrate foods in a short amount of time. The individual will eat breads and candies and cakes and sweets. The purging cycle begins immediately after, such as by going to the bathroom and vomiting the food that was just eaten or by taking laxatives. The purging creates a sense of relief after the disgust of binging for the individual. It's a very high-risk psychological disorder because it greatly impacts health. Treatment for bulimia involves psychotherapy and behavior management, but also involves medications and sometimes hospitalization. It's a very high-risk health disorder. People with bulimia nervosa often have broken blood vessels in their eyes. They have erosions on their fingers from vomiting. They lose the enamel on their teeth. Although bulimia, like the other eating disorders, is very complex, this is some of the basic information that you should know about this eating disorder.
Application in nutrition. In the case of recovery from bulimia, a registered dietitian will prioritize adequate nourishment and replenishment of any nutrient losses in the body. Medical nutrition therapy will include a meal plan that offers sufficient calories, vitamins, minerals, essential nutrients, and hydration for a person recovering from bulimia. A registered dietitian will also consider any other medical complications that have resulted from bulimia, such as an electrolyte imbalance or dehydration, and tailor the nutrition plan to address these concerns.
My name is Christine Marquette, and I'm a registered dietitian with the Austin Regional Clinic, and I'm going to talk to you about some tips for how to support someone with bulimia. Someone with bulimia often has a lot of the same characteristics as a person with anorexia. A lot of times they are using food as an area of their life that they have control over. Bulimics, what they're actually doing is typically binging on foods and then purging in some form to avoid weight gain. And purging can be either through the use of laxatives or it can be through induced vomiting. And typically, people with bulimia will go through a period of denial. They won't think that there is anything wrong with them. If they ever do reach the point where they do realize that they have a problem, the best way to support this person is typically to help them get into an inpatient treatment facility. It's very difficult to treat bulimia in an outpatient setting. There's just too many things, too many different distractions around. Again, a lot of times they're going to go back to that food as their area of control. So the best thing to do is to get into an inpatient rehabilitation facility where you can be there as emotional support, but they also have access to a therapist, access to a doctor, access to a nutrition professional, a whole team around them that will help them address all of the issues that are causing them to have this problem, this obsession with food. Typically, you as a friend or as a relative, it's good to let them know that you're there for any emotional support, but it's not a good idea to take it upon yourself to try and provide the entire treatment that this person needs. They really need to be, again, in an inpatient facility where they have a team of professionals around them that includes an actual therapist, a medical doctor, and a nutrition professional, and you would be there as their own emotional support. are just some basic tips for how to support someone with bulimia.
Complications. Bulimia may cause numerous series of even life-threatening complications. Possible complications include negative self-esteem and problems with relationships and social functioning. Dehydration, which can lead to major medical problems such as kidney failure. Heart problems such as an irregular heartbeat or heart failure, severe tooth decay and gum disease, absent or irregular periods in females, digestive problems, anxiety, depression, personality disorders or bipolar disorder, misuse of alcohol or drugs, self-injury, suicidal thought or suicide.
It's more or less the same as anorexia nervosa. But now, of course, when it comes to complications, I tend to think there could be slight difference in terms of the complications. So can we briefly talk about it before we go to binge eating?
Okay.
I think she'll be in a position.
Okay, yeah. So when you talk about bulimia nervosa, first of all, we're talking about this person. It's almost everything, but then again, even before absorption of the food nutrient, they go, and they gag it out. So we're talking about gastrointestinal complication here, whereby one, and that is really, I think, common and also, I think, also embarrassing, it's halitosis. Halitosis is whereby we have this foul smelling, or mouth foul smelling, because of all that, regurgitation, or rather, vomiting of the food. So that leaves it there. We have dental complication also, because all this acid, discoloring and all that. We have something even in reproductive system for women, whereby it does affect their menstrual cycles. It can be either irregular, or rather they can it can cease, and that we call amenorrhea. We're also talking about psychological also, whereby here we talk about depression and anxiety. We talk about low self-esteem. We talk about being disgusted with yourself. And another thing also, and this is very serious, whereby we go to cardiac complication. In cardiac complication, when we talk about malnutrition, we talk about this micronutrient, whereby calcium and potassium and magnesium, they become so low, whereby when we have potassium that is low, we call it hypokalemia, and also it does affect the conduction of the heart, whereby it can bring arrhythmia and such.
Okay. Yeah. All right. And would you want to also talk about
on
the psychological part?
Psychological part
Yes.
is the issues, what she's mentioned. It might bring anxiety, depression, and low self-esteem, like the way you look at yourself, the body image, and so those are some of the effects,
of the complications. All right.
statistics. The statistics in bulimia are shocking to most people. Eating disorders occur across a spectrum of people and can affect individuals of any gender, ethnicity, or socio-economic group. Bulimia statistics tell us that the lifetime prevalence of bulimia nervosa in the United States is 1.5% in women and 0.5% in men. This translates to approximate 0.47 million females and 1.5 million males who will have their lives threatened by this potentially deadly disorder.
% of American women suffer from bulimia nervosa in their lifetime. Approximately half of the persons with bulimia nervosa also have an anxiety disorder or depression and then other mood disorders. And 1 in 10 bulimic patients also have substance use disorder, and oftentimes that would be alcohol. And usually alcohol, because alcohol is easier to ingest and assists with purging. The more fluid you have in your system, the easier it is to purge. The mortality rate associated with bulimia nervosa is higher than the normal population.
Conclusion. In my personal conclusion, people with bulimia should have a balanced and sustainable relationship with food, free from negative and distorted thoughts about oneself. Also, following a nutrition therapy is an integral part of the eating disorder treatment and recovery process. The primary role of nutrition therapy is to assist patients in normalizing their eating patterns.